Welcome back. This week, we're going to be talking about the 5 myths associated with the third trimester of pregnancy. So, let's start with myth number one. A lot of people come to me and they talk about experiencing heartburn, and sometimes they feel like it's because maybe their baby is going to have a lot of hair, and sometimes it's just something that they mention in passing. And then when we ask what they're doing about it, a lot of times they'll say, I'm just taking some Tums just to help settle it. So, did you know that you have nerves that go to the upper part of your back, the esophagus, right up in here? So, going into your esophagus and your stomach. And a lot of times when we are doing chiropractic adjustments for our practice members, when we adjust that area, it can actually create a lot of relief for the mom to be, because as the baby's growing, it tends to push a lot of the mom's internal organs up and kind of scrunches them up in this very small space, right? And so when we do the adjustment, it can help open that up for the mom. And so one of the cool side benefits of getting adjusted sometimes is that you start noticing some improvements in your heartburn. So, from what I've seen, it doesn't seem to be caused by the amount of baby's hair that you have. Just for reference, both my children had quite a bit of hair and luckily did not experience any heartburn during either my pregnancies. My stories aside, in general, from what we've seen, and there is no clinical relevance or data to support that myth. So, if you are experiencing heartburn, there might be some other things that we could do to help you out. But one thing to perhaps consider is mentioning that to your chiropractor. Myth number two is that pregnancy brain is quote unquote normal. And sadly, while it's very, very common, right, there are so many things to pay attention to, and it can be a lot of overwhelm in mom to be's brain. And that can often be overlooked or just assumed to be part of the whole prenatal journey. And so we just call it normal. But if you've heard me speak before, if you've read any of my posts or messages, then you probably know by now that I feel that really there isn't any symptom that is normal, but rather that is just really common. So, one of the ways that we talk about helping support removal of pregnancy brain is by looking at mom's nutrition. So, for a lot of women, pregnant or not, we tend to have a lot of trouble breaking down protein and fat. And these are the nutrients that are required for rest and repair and for allowing the little covering that goes over the nerves in our body, to the myelin sheath, to be better supported and in better health. And so, what we really focus on in our practice is making sure that not only are you getting in those nutrients, right? Because if you're experiencing something like heartburn, or unfortunately, if you're maybe experiencing some nausea or morning sickness into third trimester or during your pregnancy, or just in general, if this is something that you might be experiencing or struggling with, then we want to look at not only are you getting it into your food choices, but I would say maybe more importantly is how well are you breaking that down, right? Are you getting adequate bowel movements? Did you know that you should ideally have one bowel movement for every meal that you eat? Yeah. It's kind of surprising for many of my practice members when we talk about that, because we get so used to experiencing whatever our quote unquote normal is, right? Whether that's once a day, once every other day, a few times a week, whatever that looks like for us, that just becomes what we expect. And so anything in that kind of realm feels okay. So we want to look at how well are you digesting your foods, and if we can improve that digestion, it actually tends to help alleviate a lot of the pregnancy brain symptoms. Now, myth number three is that when we start to experience waking up in the middle of the night to use the restroom to urinate, a lot of times women will tell me that, oh, I think the baby's just pushing on my bladder. Now, if you're in the first 34, 35 weeks of your pregnancy, it's it's possible towards the end, but it's unlikely that it's the baby actually pushing on the bladder, because the baby has to be pretty low to push on your bladder. What tends to be more common, the reason, especially if we're in the earlier stages of pregnancy or even early third trimester, is that we're actually tend to be dehydrated. Now, this sounds a little bit counterintuitive, right? Because if we were dehydrated, why would we be using the restroom? But the analogy I like to give here is that it's almost like if you're watering a dry plant, right? Have you ever watered a dry plant before? And then you water it, and then what happens? The water just kind of goes straight through, right? And so the soil got wet, but the plant didn't really receive any of that hydration. So it's kind of similar with the cells in our bodies, right? If we are kind of chronically dehydrated, then the cells can't absorb the water as optimally as we would like. And so the water kind of bounces off the cell and then comes out in our urine. And so one of the things that I have my practice members try, especially if you're drinking filtered water, which is great if you are, but if you're drinking filtered water that has been demineralized, right, as part of the filtration process. So we want to make sure that you're getting mineralization back in your system and back in your water. So one of the best ways that I found that can really help is really simple. If you get some pink salt or Himalayan salt, as it can go by either name, taking a small pinch of that and adding that to your glass or bottle every time you drink water, especially if you are drinking water in the evening or soon before going to bed, making sure that you have some of that minerals back in your water. What that does is it actually allows the water to become better absorbed into the cells of your body. And then it gets processed. It allows nutrients and water to come into the cells. It allows waste to come out of the cells. So it opens up that dual flow mechanism much more optimally. But in terms of nighttime urination, it allows for better absorption of the water. So it actually delays the process in which you need to urinate, ideally allowing you to get better quality of sleep through the night so it's not getting interrupted. And then you wake up in the morning and then need to use the restroom. Myth number 4, this was actually something that caught me a little off guard the first time I was pregnant because I hadn't quite realized the actual percentage of this stat. The myth is that labor begins with your water breaking, but in fact, it's actually with the contractions. And the stat that kind of threw me off was that it's only in about 10 to 15% of births, regardless of if it's your first, your third, your fifth, it doesn't matter. In all the births, about 10 to 15% of the time is when the water breaks. The rest of the time, the water may need to be broken or it happens after the contractions have started. And so the labor has actually begun with your contractions. So in terms of contractions and labor and all of that, a lot of times we kind of assume that the anticipated due date, I keep hoping that there'll be a different term that's being used, but the expected due date or the EDD is what we kind of hang our hat on to say that this is when the baby's coming. But in a case where there is no medical intervention, the actual stat for the average birth time is actually at 41 weeks and 2 days, which is actually much later than most people realize. So, just a little fun fact for you with that. And then the last thing I wanted to talk about, myth number 5, is that a lot of times people get concerned or they'll come into my practice talking about the baby's size, right? Particularly after an ultrasound, they get really concerned that, oh my gosh, my baby's going to be X pounds or so big, and how am I going to get through this? Do I need to schedule a C-section? What's happening? Like, what I tell my practice members as well is that more so than the baby's size, what we're actually trying to focus on is the baby's position. That has a lot more impact on the ease of labor, the ease of your delivery, and the potential reduction of any kind of medical intervention. So the idea is to have the baby be in a head down position and have the baby stay head down by having the mom's pelvis stay in better alignment. So, right, we have all of the pelvic floor muscles which can contract and respond according to the mom's pelvic alignment. And so, if a lot of times we get a call looking for someone certified in the Webster technique because people are concerned that they might otherwise have a breech presentation or a transverse presentation, and they're looking for alternatives in finding another solution. And so the Webster technique is actually looking at helping to create stability in the mom's pelvis so that the round ligaments and the pelvic floor muscles and all of those structures and tissues can be a little bit more balanced out and respond appropriately rather than being contracted in one way or in another way. And then it essentially makes the baby feel like there isn't optimal space to be head down. And so then the baby will often go into a breech or transverse presentation. So looking at the baby's alignment and position is actually way more important in my mind than looking at the baby's size, because our muscles, if they are aligned properly, if the tissues are working properly, they can contract and expand and do what they need to do at the time of labor in order for the baby to be born in as easy a way as possible. Join us next week. We're going to talk about the 5 myths related to postpartum, and can't wait to see you then. Thanks.